Hi, this is Dr. Murthy. I'm a breast cancer surgeon practicing in HCG Cancer Center in Bombay. The last 15 years I've been in the US, and then I've started my practice here for the past 2 years. My area of expertise has mainly been in breast cancer, both in very early screen detected cancers to managing even locally advanced cancers. So in general, the practice that I have seen in the US is very different from what we see in India. In India, we do see a lot of mid to locally advanced cancers, whereas in the US, we used to see very small and very early screen detected cancers. So the difference is the way we manage these things. In the US, we were able to get away with very small lumpectomies and very small procedures. Here also, we are trying our best to do as much as breast conservation as possible along with oncoplasty. So why we are talking about this MOZART system is MOZART system is a 3D tomosynthesis image which we are doing intraoperatively. It's an intraoperative mammography, and it is very crucial in our practice because when we deal with small cancers and when we are trying to preserve as much breast as possible, we want to make sure that we have hit the target correctly and we are able to get the tumor along with the rim of normal tissue without compromising the oncological principles of surgery. The places where I have used these things are both in the US, where we have used it for image-guided surgeries, while we have used guided wire, as well as where we have used MAC-seed as a way to localize these tumors. While we do these tumor localizations, when we go in and take out these tumors, what MOZART does for us is it gives a 1 millimeter slice kind of images of these tumors. So we know exactly intraoperatively whether we have got the margins or no, whether we are able to get the entire specimen. These things are important when we are doing breast conservation because it not only gives us an indication that we have got the tumor, but also the calcifications around it, as well as small architectural distortions which may be associated with the tumor. How is it different from a 2D specimen mammography is this gives us 1 millimeter slices. Intraoperatively itself we are able to see whether or not we have got adequate margins. There is a blend of both the optical image as well as the X-ray image. Given all these things, the reduction of taking back a patient to the OR in terms of re-excision is brought down by close to 50%, which is a big win, not just for the surgeon, but also for the patient who does not have to go through another surgery, another anesthesia, and just the psychological impact of having to do a re-excision, which is very, psychologically kind of demotivating for a patient if they have to go back, even though it may be just for a rim of normal tissue. These are all the various advantages which we have experienced in the US, and I would be more than happy if we can bring this technology to India and we can use it on our Indian patients as well.